Hi, my name is Zach Witzel. I'm a student physical therapist assistant, and I'm doing a presentation on a treatment plan of Erbs palsy or brachial plexus injury. Today we're going to be performing some range of motion measurements, exercises to strengthen and stretch, and then some passive range of motion on the upper extremity to be performed on a patient who has Erbs palsy. Good. We're going to be measuring shoulder flexion, and the landmarks that we're going to be using is going to be the greater tubercle of the humerus, the lateral epicondyle of the humerus, and the midline of the trunk. So you're going to have the patient raise the hand above their head. This patient is currently at 165 degrees. Normal is 0 to 180 degrees. Now we're going to be testing shoulder extension. Again, the major landmarks we're going to be using are going to be the greater tubercle of the humerus, the midline of the trunk, and then the lateral epicondyle of the humerus. All right, sir, please go ahead and pull your arm up towards your back like so. Hold it there. Okay, go ahead and relax your arm. Thank you. This patient is at 23 degrees. Normal is 60 degrees, or 0 to 60 degrees. Now we're going to be measuring extension and flexion of the elbow. The major landmarks we're going to be using, the axis is going to be placed over the lateral epicondyle of the humerus. The proximal arm is going to be placed on the midline of the humerus, and the radial styloid is going to be in line with our distal arm, moving arm. Sir, go ahead and flex your elbow for me. Okay, and we are at 133 flexion, and go ahead and extend your arm out for me as far as you can. We will use the same landmarks. Okay, this patient's extension is 5 degrees and his flexion is 135 degrees. All right, and so now what we're going to do is we're actually going to measure the wrist flexion and extension of the patient's right arm or right wrist. So in order to get into position for this, we're going to have the arm abducted to 90 degrees, the elbow bent to 90 degrees with the hand hanging off the table. And our landmarks are going to be the fulcrum goes over the triquetrum on the lateral portion of the hand. The proximal arm is going to be in line with the ulna up towards the olecranon process, and the distal arm is going to be parallel with the fifth metacarpal. Please, if you would not mind, try to pull your palm down as far as you can. Flex your wrist. Good. Good. All right, and now I'll have this patient here. You can go ahead and relax that hand. This patient is at approximately 75 degrees of flexion. And now, since I have her here, I'm actually going to go ahead and measure her extension as well. In order to do that, hand is going to be up so the palm is facing forward. Good, and the landmarks are going to be the exact same. Good. All right, you can go ahead and relax. This patient is at approximately, she's more than normal. So she is at approximately 72. The norm for this is going to be 0 to 70 degrees for extension and 0 to 80 degrees for flexion. All right, now what we're going to do is we're going to perform passive range of motion on the patient's left upper extremity. So starting off here distally, we're going to start off with the fingers, and you want to bring the fingers to full extension, bring them into full flexion, and you want to do this 8 to 10 times. Do this with the thumb as well. You can also come up here by the patient's head. And we want to work on wrist flexion and extension, as well as radial and ulnar deviation. And you can actually combine those movements into just doing circumduction of the wrist. You want to make sure you stabilize the radius and the ulna so that they're not pronating or supinating, and all the motion is coming from the wrist itself. Once you get that done, you can then move a little bit more proximal, move up to the radius and the ulna itself. You want to make sure to just move those bones and not move at the wrist. So you're going to just apply force to the radius and the ulna to create pronation, and then back into supination. So in range. Then you move up here, and you can have the arm supported by a towel, or you can also support it with your hand, and you want to pull the elbow into full flexion and extend it out into full extension. You then move on to the shoulder. And you can start off with just flexion and extension of the shoulder by bringing the hand above the patient's head, supporting the humerus the whole time so it's not just hanging. Then you can move into abduction and adduction. Bring it into the thumbs up position so the thumb is facing towards the patient's head to avoid impingement. You can then bring the shoulder directly out to the side, and you can work on horizontal adduction and abduction. Bring it across the patient's chest as far as they comfortably can go. Bring it out to the side. And then you also want to work on internal and external rotation of the upper extremity. Have the arm abducted to 90 degrees and the elbow flexed to 90 degrees. Just let it come down like that in both directions. And that is passive range of motion for the upper extremity. All right, the next thing we're going to do is we're going to do a strengthening exercise for the biceps muscle. Starting off, we're going to do an isometric exercise for the biceps. Patient is going to be in seated position with arm or elbow flexed to 90 degrees, palm against the bottom of the stationary object. In this case, we're using a table, and they are going to apply an upward force to create an isometric strain on the biceps muscle itself. So if you would not mind, sir, please go ahead. Good. And you're just going to try to lift the table up. Hold, 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 and relax. We will do this for approximately 10 seconds, and we can do this for 3 sets of 10 repetitions. Once the patient has progressed past needing to use isometric exercises to strengthen the biceps muscle, you can use more dynamic exercises like bicep curl.